We will be having a very interesting question that why there is coagulopathy or why there is increased bleeding risk or why APTT or INR these are increased in cirrhotic patients or in CLD patients. Now we must understand one thing that liver is the production house of our body and liver hepatocyte, which is the basic cell of the liver. Hepat means liver, so it is the liver cell which is called hepatocyte is the main site to synthesize to produce all the coagulation factors. So it produces all the coagulation factors except one Willebrand factor and factor 8C. So these two factors are not synthesized by the liver. Otherwise, all the clotting factors, all the coagulation factors are synthesized by the liver. This includes the vitamin K dependent factor also, because vitamin K produces or vitamin K is needed to synthesize factor 2, factor 7, factor 9 and factor 10. So these four factors need vitamin K, and this vitamin K is basically a fat soluble vitamin that is usually produced by intestinal bacteria. So very commonly, there should not be a problem uh, for production of vitamin K, but whenever there is cholestasis, whenever there is intrahepatic or extrahepatic cholestasis or obstruction, or if there is treatment with antibiotics, it very commonly, especially oral antibiotics, it destroys the intestinal bacteria and then it reduces the vitamin K. That is how it reduces the factor 2, 7, 9 and 10. So what we are talking that all the coagulation factors except one Willebrand factor and factor 8C, they are produced in the hepatocytes, and almost all these clotting factors have a very short half-life. So if liver stops producing these proteins, these clotting factors, automatically within few hours the coagulopathy starts setting in. In fact, the factor 7, which is one of the most important coagulation factor for coagulation, has half-life of hardly 100 to 300 minutes. So in short, within 1.5 hours to within around 5 hours, the factor 7 starts degrading, starts getting reduced. So coagulopathy may start to show within 24 hours to 48 hours. That is the reason why in cirrhosis, in liver disorders, the clotting factor synthesis falls and coagulopathy sets in, and these in short are reflected by derangement in APTT or derangement in INR, as we know that the activated partial thromboplastin time, which normally should be around 60 seconds, and INR should be 1, which is normal. So this keeps on increasing if there is coagulopathy, and INR also increases to 1.5 to 2.5 depending on how much coagulopathy is there. So this is for all for today. Thanks for your listening.